right, guys, it's time to go over one of my favorite topics, cardiac. I have 10 questions. Let's answer them together. Question 1. A patient with an acute myocardial infarction arrived 45 minutes ago. Which finding is most concerning and requires immediate action? Option A, a blood pressure of 142/88. Option B, a heart rate of 110. Option C, a new onset of cool, clammy skin and decreased level of consciousness. Or option D, oxygen saturations of 93% on 2 liters. I'll give you guys about 5 seconds to answer this. I hope you guys chose option C. Option C is correct because changes in level of consciousness with cool, clammy skin indicates a decreased cardiac output, but it also can show signs of possible cardiogenic shock. Option A is incorrect because a BP of 142/88 is not necessarily abnormal in the context of a myocardial infarction. B is incorrect because tachycardia can occur with pain, anxiety, or MI. And then D is incorrect because an O2 sat of 93 is low, but is not immediately life-threatening, and it can be maintained with oxygen. Question number 2. A patient with heart failure ejection fraction of 25% reports increased shortness of breath. Which assessment finding should the nurse prioritize? Option A, bilateral crackles in the lower lobes. Option B, mild ankle edema. Option C, jugular vein distension. Or option D, weight gain of 1 pound or 4 pounds in 2 days. Sorry. A is the correct answer to this. I understand that this is a heart failure question, but it also ties back into the lungs. So with that being said, bilateral crackles in that lower lobe can cause that impaired gas exchange. And when you have impaired gas exchange, that means that we're not blowing off the CO2. And once our CO2 levels get too high and we start retaining it, it could potentially put that patient in a coma or cause death. So our priority in this question, because that patient is experiencing that shortness of breath, we want to get that fluid off of them to get their lungs working properly again. So the first thing we're going to do is Lasix and get it off of them. But option B is incorrect because mild ankle edema is important, but it's less urgent than the respiratory compromise that's going on. And honestly, once you start giving them Lasix, that edema will really start to go down. And then option C is incorrect because JVD, it does indicate that right-sided fluid overload, but it's less immediately life-threatening than that pulmonary congestion that we have going on. And then option D, once again, is incorrect. We're not too concerned about the patient gaining the weight because we know why. They're gaining the weight because their body is retaining and keeping this fluid. So once we give them that Lasix to help get that fluid off of their lungs or all that stuff, that patient will also begin to lose the weight as well. Question number 3. A patient has a dysrhythmia on the monitor. The nurse notes the rhythm strip below. What is the best interpretation? Option A, sinus tachycardia. Option B, atrial fibrillation. Option C, atrial flutter. Or option D, supraventricular tachycardia. Okay, I hope you guys chose option B, atrial flutter, aka AFib. Now, it is AFib because it shows an irregular rhythm with no discernible P waves. So that means that there's no P waves present. Which, when there's no P waves present, then we automatically know that it'll probably be some type of atrial rhythm. And option A is incorrect because sinus tach has a regular rhythm, but it also has a P wave before every QRS interval. And then option C is incorrect because atrial flutter shows sawtooth flutter waves with no regular conduction. And then it's clearly not supraventricular tachycardia. Question 4. A client develops a sudden onset of palpitations. The monitor shows a narrow complex tachycardia at 180 beats per minute. The client is alert but reports dizziness and has a blood pressure of 88/60. What is the priority in this assessment? A. Instruct the client to perform the Valsalva maneuver. B. Prepare for a synchronized cardioversion. C. Apply oxygen via nasal cannula. Or D. Obtain a 12 lead EKG. All right, hopefully you guys chose B, that we're going to prepare for a synchronized cardioversion. So in this question, they describe to you supraventricular tachycardia, aka SVT. And the description of that was narrow complex tachycardia at 180 beats per minute. So, fun fact for those of you who did not know, even though it's SVT, it's actually a problem with the atrial. So, it's an atrium rhythm. But either way it goes, we're not going to have this patient Valsalva maneuver anymore because they're showing signs of being unstable, such as blood pressure becoming super soft, and they're showing symptoms of dizziness. So now they are deemed unstable, like stated. We are going to go straight to having them do a cardioversion. Now, we could apply oxygen. That would just make them probably feel a little bit better and make them sat a little bit better, but it's not going to fix the issue or prevent the issue from happening again. And we don't need a 12 lead EKG because we can clearly see on the heart monitor that they're hooked up on that they're having SVT. Question number 5. Which client is at highest risk for developing left sided heart failure? A. A client with severe COPD. B. A client with a history of long term hypertension. C. A client with cirrhosis of the liver. Or D. A client with chronic kidney disease. The correct option here is option B, a client with a history of long term hypertension. So, long term hypertension causes an increased afterload, which then leads to a left ventricular hypertrophy, and then it eventually turns into left sided heart failure. Also, if you guys did not know, increased afterload is the resistance the ventricles must overcome to eject blood. So that primarily is caused by hypertension. So that means the heart has to work harder, and that right there will lower your ejection fraction, which then turns into the heart failure that we are talking about. COPD, that causes right-sided heart failure. Option C, cirrhosis leads to fluid overload but does not directly cause heart failure or left sided heart failure. And then option D, CKD can contribute to fluid overload, but hypertension is the strongest direct risk factor for that left sided heart failure. Question number 6. A patient is scheduled for a cardiac catheterization. Which instruction is most important for the nurse to provide? A. You will need to drink plenty of fluids after the procedure. B. You will need to urinate before the procedure. C. You will need to keep your legs straight for several hours after. Or D. You will need to be able to eat a full meal right after the procedure. Alrighty, I hope you guys chose option C. You will need to keep your legs straight for several hours after. This helps prevent bleeding and hematomas after the procedures. A lot of the cardiac calves go through the femoral growing, so you want to make sure that artery does not bleed out after. So they come up normally with like a little white patch with tegaderm, and you just have to monitor that site for so many hours after they have already been lying flat. Also, A is incorrect. Like, you want to encourage fluids, but it's not the most important thing. I mean, and then B is just if you void before the procedure, that's fine. If not, that's also fine. And then D, you may not even be able to tolerate a full meal. So sometimes after you go through anesthesia and all that stuff, they will literally just put you on a clear liquid diet, and they'll tell the nurses to advance this diet as tolerated. So in this scenario, the most important thing is keeping that body straight and preventing bleeding and hematomas from happening. Question 7. A patient with stable angina reports chest discomfort that occurs with walking uphill and is relieved with rest. Which finding would indicate a change to unstable angina? A. A pain that lasts less than 5 minutes. B. Pain that occurs at rest. C. Pain that is relieved with rest. Or D. Pain that occurs with exertion only. The correct answer here is B, pain that occurs at rest. So A says pain that lasts less than 5 minutes. That is a sign of angina that's stable. Option D says pain that occurs with exertion only. That is also a sign of angina that is stable because that indicates that when the patient is resting, they have no pain. And if you read back and read the question, that patient stated that that was what was happening at first. They were walking and then it was relieved by rest. And then option C, pain that was relieved at rest, which is what the patient described in the beginning of that question as well, is also a sign of stable angina. Unstable angina is pain that occurs at rest. So even though we're resting, even though our heart isn't working, my chest is still in pain. So now we have to figure out the interventions that need to be done to help this patient relieve this chest pain that he is having. Question number 8. After a PCA pump was discontinued post myocardial infarction, which findings should the nurse report to the provider? A pain level of 2 out of 10. B, a heart rate of 102. C, a respiratory rate of 10 beats per minute. Or D, a blood pressure of 118 over 72. Answer here is C, a respiratory rate of 10. So as we know, those PCA pumps deliver narcotics to our patients, and we all know that narcotics can cause respiratory depression. This patient is experiencing respiratory depression because the respiratory rate for an adult should be between 12 and 20. So for them to be lower than 10, we should hold narcotics at that point. Also, A is wrong because a pain level of 2 out of 10 should be acceptable. B is wrong because a heart rate of 102, yeah, it is sinus tag, but it's not the most important thing. And sometimes a patient will have that post myocardial infarction. And then D is incorrect because 118 over 72 for a blood pressure is actually within normal limits. Question number 9. A patient with right-sided heart failure is most likely to present with which finding? A, pulmonary crackles. B, orthopnea. C, jugular vein distension. Or D, dyspnea on exertion. So the correct answer here is C, jugular vein distension, aka JVD. With that being said, JVD occurs when blood backs up into the systemic circulation, which is due to right-sided heart failure. Another thing that really helped me out when I was going through nursing school was understanding that left-sided heart failure normally showed up with pulmonary symptoms. So pulmonary crackles and orthopnea are signs of pulmonary symptoms, which is why those two are primarily diagnosed or seen inside of left-sided heart failure. And then dyspnea on exertion, that can happen between both. So that's a little tip for you. Left side lungs, and you will see manifestation of lung issues when you have left-sided heart failure. Question 10. A patient with a pacemaker reports feeling lightheaded. Which finding should the nurse suspect as the cause? A, pacemaker failure. B, lead displacement. C, battery depletion. Or D, oversensing. The correct option here is B, lead displacement, which can cause an ineffective pacing, which results in decreased cardiac output and symptoms like lightheadedness. A is incorrect because pacemaker failure is rare and usually is identified when the pacemaker is being integrated. C is incorrect because battery depletion causes loss of pacing without symptoms until it's severe. And then D is incorrect because oversensing usually causes pacing inhibition, but not lightheadedness. That is it for today, guys. Thank you so much for watching this video. If you really liked it, enjoyed it, any feedback, make sure you leave it in the comments. If you have topics that you want to go over, let me know. If you guys, anything that you guys want to tell me, make sure you leave it down below and we can get it going for next week. Thank you guys so much for liking, sharing, subscribing, and commenting, and just staying engaged. See you guys next week. Goodbye.